Morning, I promised we would talk a little bit about how we can improve transitions of care, and so that's what this afternoon is about. But if you didn't make it this morning, I would like to just review what we talked about very briefly, just one slide. Like we've heard today, there are a lot of problems with hospital discharge, and we send patients home from the hospital. It can be very dangerous. The communication that we have with patients is poor. The communication that we have with other doctors is poor. And it's no surprise that patients experience a lot of harm. 1 out of every 2 patients has a medical error. 1 out of every 5 patients experiences an adverse event. And 1 out of every 5 elderly patients gets readmitted to the hospital within 30 days of their discharge. And it's our responsibility to have better communication and coordination of care, particularly as patients are being admitted to the hospital and discharged from the hospital. So how do we do that? That's what we'll talk about. There's a very nice review article that one of my colleagues wrote in the Annals of Internal Medicine in December 2011. And what they did is they studied all the kinds of interventions that exist to reduce hospital readmission and improve transitions of care. And they divided these into categories. And I find this a helpful way to think about what we can do as doctors and what our colleagues in nursing and pharmacy can also do. If we think about these interventions in different time points, there are things that we can do before the patient goes home from the hospital, things that we can do after they've been discharged from the hospital, and other things that bridge the time period, which help them in both places. So before discharge, we can focus on educating patients more about their medical condition. We can do better planning for what comes next. We can reconcile their medicines and make sure that we have one good list of medicines for the patient, and we can help them on scheduling appointments in a more convenient time. After the patient goes home from the hospital, one important thing that can help improve the transition of care is to have a good rapid follow-up appointment. There are a lot of hospitals now in the U.S., for example, that are trying to make sure the patients have an appointment within 1 week of their discharge from the hospital. We also need to communicate in a timely way with the primary care physician. So it's our responsibility as a hospitalist to be sure that when we are sending somebody home, we call the primary care doctor on the phone, and that we also send them a discharge summary, preferably within 2 or 3 days of when the patient leaves the hospital, because the patient will be contacting them very soon. One other thing that a lot of people do is call the patients at home on the telephone and see how they're doing. We'll talk a little bit more about that. And also we need to give patients access. So back home we call this a hotline. It's a number that the patients can call anytime to reach somebody in the hospital if they have questions about what's going on. And then we just heard 2 presentations about home visits. Those also are very important and are things that we can do after the patient has left the hospital to improve their transition period. Then there's some different interventions put in the category of bridging. So these are things that start in the hospital and then continue even after the patient goes home. One of them is making nice, plain, easy to understand discharge instructions for the patient. And I'll show you an example of that later. Another type of intervention is a transition coach, somebody who helps the patient, who meets them in the hospital, and then helps them after they've gotten home. And also, it's worth noting that just having the same doctor take care of the patients, or at least having doctors communicate well with each other, can provide some continuity. Continuity among the physicians taking care of the patients. Can start in the hospital and then continue till after they go home. So in this article, what they did is, with each of these types of interventions at different time points, they reviewed all the medical literature and summarized what we know about what interventions work and which ones don't work so well. What I'd like to do is not review all the interventions that have ever been developed and tested to improve care transitions, but instead just review a few good examples. We heard briefly about two of these earlier today.